Every type of body fluid explained. Your body is roughly 60% liquid, and every drop is working a different job, moving oxygen, cushioning joints, digesting lunch, or carrying signals between organs that never touch. This is the full map of what's flowing inside you right now. Blood. The fluid connective tissue that circulates through your heart and vessels, delivering oxygen, nutrients, hormones, and immune cells to every living cell while hauling waste away. An adult carries about 5 liters, made of red cells, white cells, platelets, and plasma, which makes up over half the volume. William Harvey first correctly described its circulation in 1628, overturning the belief that blood was simply consumed like fuel in a fire. Think of it as a citywide delivery and sanitation service running at once. Red cells are trucks stacked with oxygen cargo. White cells are the police patrol. Platelets are the road crew that shows up the instant a pipe bursts. Unlike lymph, which drains passively with no central pump, blood is pressurized by the heart, completing a full lap of the body in under a minute. A paper cut sealing itself into a red-brown scab is platelets and the protein fibrin doing emergency construction in real time. However, that same clotting system can turn against you. Activated inappropriately inside an intact vessel, it causes strokes and heart attacks. Blood is the river every other fluid on this list ultimately answers to. Plasma. The pale yellow liquid matrix of blood, the water-based solution that carries red cells, white cells, and platelets while dissolving proteins, salts, hormones, and clotting factors. It's over 90% water, with the rest packed with more than 700 proteins, the most abundant being albumin, which keeps fluid from leaking out of vessels into surrounding tissue. Picture it as the river itself, rather than the boats floating on it. The actual medium that lets any passenger, hormone or antibody, travel anywhere. Unlike serum, which is what's left after clotting factors are removed, this fluid retains those factors and stays capable of clotting on its own, which is why donated plasma is frozen for patients with bleeding disorders. Hospitals transfuse it into trauma and burn victims to restore volume and clotting capacity fast. The problem is its rich protein content makes it a favorite target for pathogens, part of why the liver works constantly to rebuild it. Every hormone that has ever changed how you feel traveled there by boat, and this was the water underneath it. Lymph, the clear fluid that seeps from blood capillaries into the spaces between cells, gets collected by a separate vessel network and drains back into the bloodstream near the base of your neck. It starts as filtered plasma, minus red cells, and by the time it passes through your roughly 600 lymph nodes, it's loaded with lymphocytes, scanning for threats. Unlike blood, this system has no central pump. It depends on the squeezing of skeletal muscles and one-way valves, which is why sitting too long causes swelling in the legs. Think of the whole network as a city's storm drain system, quietly collecting runoff, filtering it through checkpoint stations, the lymph nodes, and returning clean water to the main river. Those checkpoints are where your immune system gets its first look at anything suspicious, which is why nodes swell painfully during infection. However, when this drainage is damaged by surgery, radiation, or parasites, fluid backs up with nowhere to go, causing a permanent swelling called lymphedema. It never gets blood's glory, but without it, every tissue would drown in its own runoff. Cerebrospinal fluid. Often shortened to CSF, this clear liquid bathes your brain and spinal cord, filling the brain's ventricles and the space around the spinal cord. About 150 milliliters circulates at any moment, and your body produces and reabsorbs roughly that entire volume several times a day. Picture it as a shock absorber and cleanup crew combined. It suspends your roughly 3-pound brain in internal flotation, cutting its effective weight to about that of a golf ball, while flushing metabolic waste out the way a factory's ventilation clears fumes. Unlike blood, which freely exchanges substances with tissue throughout the body, this fluid sits behind the blood-brain barrier, a checkpoint that keeps out most bacteria, toxins, and even many medications, which is why brain infections are so hard to treat. Doctors sample it through a lumbar puncture to diagnose conditions like meningitis. The problem is that the same barrier that keeps threats out also traps pressure in. Blocked drainage causes fluid to build inside the skull, a condition called hydrocephalus. Every thought you've had was floating, quite literally, in this fluid. Synovial fluid. The thick, egg white-like liquid inside the capsules of your movable joints, knees, elbows, hips, knuckles. Rich in a molecule called hyaluronic acid, it gives the fluid a viscosity close to raw egg white, and a healthy knee holds only a few milliliters. Think of it as industrial lubricant in a hinge built to survive decades of use. It coats cartilage so bones glide with almost no friction, while also delivering nutrients, since cartilage has no blood supply of its own. Unlike blood or lymph, it isn't constantly flowing. It's a static pool mechanically pumped through cartilage every time you bend and straighten a joint, meaning movement is what keeps cartilage fed. This is why immobilized limbs lose cartilage thickness, and why physical therapists push movement even when it hurts. However, when this lubrication fails as cartilage wears down in osteoarthritis, bone eventually grinds on bone, and in gout, sharp uric acid crystals form directly inside the fluid, turning lubricant into irritant. Every step you take is negotiated by a few drops doing the work of motor oil in a machine never designed to be replaced. Saliva. The watery secretion from three major gland pairs, the parotid, submandibular, and sublingual glands, plus hundreds of smaller glands in your cheeks and lips. You produce 1/2 liter to 1.5 liters daily, over 98% water, the rest enzymes, electrolytes, and antimicrobial proteins. Picture these glands as a pre-treatment plant at the entrance of your digestive factory. Before food reaches the stomach, the enzyme amylase has already started breaking starches into simple sugars, part of why bread tastes sweeter the longer you chew it. Unlike gastric juice, which relies on strong acid, this fluid works at neutral pH using enzymes, and it also lubricates food into a soft mass called a bolus. It acts as a constant antiseptic wash for teeth and gums, which is why reduced production sharply raises cavity risk. However, it's also a major transmission route for pathogens, expelled every time you talk, cough, or share a drink. The next time your mouth waters at the smell of food, digestion has already begun before a single bite. Gastric juice. The highly acidic fluid from glands lining your stomach wall, a mix of hydrochloric acid, the enzyme pepsin, and mucus, produced at 2 to 3 liters a day. Its acid drops stomach pH to somewhere between 1 and 2, roughly battery acid strength, capable of dissolving a chicken bone left in it for days. Think of it as a demolition crew paired with a chemical plant. Acid unfolds proteins, uncoiling their structure the way heat unfolds an origami sculpture, exposing them to pepsin, which cuts them into fragments your intestines can absorb. Unlike bile, which breaks fat apart without chemically altering it, this fluid transforms what it touches. And unlike saliva's gentle approach, its strategy is controlled corrosion. So why doesn't the stomach digest itself? A thick, constantly regenerated layer of bicarbonate-rich mucus neutralizes acid before it reaches living cells underneath. However, when that mucus layer is worn down by bacteria, certain medications, or excess acid, the lining erodes into painful peptic ulcers. This is proof your body runs a contained acid bath, and only a thin film of mucus stands between digestion and self-destruction. Bile. The dark yellow-green fluid made continuously by the liver and stored in the gallbladder, released into the small intestine whenever fatty food arrives. The liver produces roughly 1/2 liter to 1 liter daily. Its key ingredients bile salts, cholesterol, and bilirubin, a pigment left from breaking down old red blood cells, which gives bile and eventually stool its color. Picture it as detergent squirted onto a greasy pan. Fat won't dissolve in a watery gut any more than oil dissolves in water. So bile salts surround fat globules and break them into microscopic droplets, emulsification, massively increasing surface area for enzymes to act on. Unlike gastric juice, this fluid doesn't chemically digest anything. It's a dispersant that sets fat up for digestion downstream. Gallstones form when its cholesterol or bilirubin crystallizes, sometimes small as sand, sometimes large enough to block the duct and cause severe pain. The problem is bile also carries cholesterol and processed toxins out through the intestines. So a diseased liver doesn't just impair digestion, it lets waste accumulate, sometimes turning skin and eyes yellow in jaundice. Bile is detergent, waste truck, and digestive aid rolled into one continuously dripping fluid. Mucus. The thick, slippery secretion from goblet cells and mucus glands lining your respiratory tract, digestive tract, and other surfaces exposed to the outside world. Its structural ingredient is a family of tangled proteins called mucins, which trap water into a gel, thin or thick depending on location and purpose. Picture it as flypaper across every entrance to your body. Dust, pollen, bacteria, and viruses stick to this layer instead of reaching delicate tissue beneath. While in the airways, tiny hair-like cilia beat in coordinated waves, sweeping debris out the way a conveyor belt clears scrap off a factory floor. Unlike gastric juice or bile, built to break things down, this fluid's job is defensive containment, catching threats rather than destroying them, though it does carry some antimicrobial proteins. A cold triggers a flood of it because your body is deliberately overproducing flypaper and hosing invaders back out. However, when the cilia that sweep it away are paralyzed or missing from genetic conditions or prolonged smoking, it pools instead of clearing, breeding chronic infection. Every breath you've taken today was already filtered by a sticky trap you never had to think about. Sweat, the watery fluid released by 2 to 4 million glands across your skin, mostly water plus dissolved salts, urea, and lactate. Most comes from eccrine glands covering nearly your whole body, while apocrine glands, concentrated in the armpits and groin, release a thicker, protein-rich version that bacteria break down into body odor. Think of these glands as a rooftop cooling system. As fluid reaches the skin and evaporates, it pulls heat away from the body, the same physics that cools skin when rubbing alcohol evaporates off it. Unlike tears, produced at a steady, slow trickle regardless of temperature, sweat production spikes almost instantly with heat, exertion, or stress, since some glands are triggered directly by the fight-or-flight response. In extreme heat, you can lose over a liter an hour, which is why athletes lose noticeable weight during competition and why replacing electrolytes matters as much as replacing water. However, this system fails in high humidity, since fluid that can't evaporate cools nothing, which is why humid heat feels far more dangerous than dry heat at the same temperature. Sweat is your body quietly running an air conditioner it can never fully switch off. Tears, the salty fluid from the lacrimal glands above each eye, continuously secreted to keep the eyeball moist, clear of debris, and protected from infection. There are 3 kinds: basal tears coating the eye at about a milliliter a day, reflex tears triggered by irritants like onion vapor, and emotional tears, which researchers have found carry a distinct chemical makeup, including stress hormones, though the full purpose of crying is still debated. Picture the basal layer as windshield wiper fluid on a slow, permanent drip, swept across the eye with every blink, smoothing the cornea and washing away grit before it can scratch. Unlike sweat, which cools, or saliva, which digests, this fluid exists almost entirely for protection, containing the enzyme lysozyme, which can rupture bacterial walls on contact. When it's overproduced faster than a small duct at the eye's corner can drain it into the nasal cavity, which is also why crying makes your nose run, it spills visibly down the cheek. However, too little tear production causes painfully dry eyes, while too much blurs vision, either way disrupting the eye's optical surface. Every blink you've taken without noticing was a tiny act of maintenance keeping your vision sharp. Interstitial fluid. The thin liquid filling the microscopic spaces between your cells, outside blood and lymphatic vessels, bathing nearly every cell directly. It makes up roughly a quarter of total body water, more than plasma itself, forming continuously as pressure pushes plasma out through thin capillary walls. Picture it as the water supply piped directly to every house on a street, while blood vessels are the mains running under the road. Blood never touches most cells directly, so nutrients and oxygen diffuse across this fluid to reach them, while waste makes the return trip. Unlike lymph, which is this same fluid after collection into lymphatic vessels. Interstitial fluid is what's still sitting loose in tissue, not yet gathered up, essentially lymph's earlier life stage. The balance between fluid pushed out and drawn back, largely controlled by albumin's pull, usually stays precise. However, when it tips, from heart failure, liver disease, or prolonged standing, fluid builds up faster than it drains, producing visible swelling called edema. This is the quiet, invisible sea every one of your trillions of cells is permanently floating in. Amniotic fluid. The clear liquid filling the amniotic sac around a developing fetus, changing composition across pregnancy, starting as filtered maternal plasma and, by the second trimester, becoming mostly fetal urine as the kidneys begin working. By around 36 weeks of pregnancy, typically holds close to a liter, a volume that declines slightly as delivery nears. Think of it as a climate-controlled, shock-padded shipping container. It cushions the fetus against impacts, holds a stable temperature, and gives room to move and kick, movement essential for muscle and joint development. Unlike interstitial fluid or plasma, which stay largely fixed in composition, this fluid is swallowed by the fetus, processed through its digestive and urinary systems, and recycled back into the sac, training lungs and gut for functions they won't fully use until birth. Doctors sample it through amniocentesis to test for genetic conditions or lung maturity. However, too little of it can signal restricted growth or kidney trouble, while too much links to maternal diabetes or fetal swallowing difficulties, making its volume one of the simplest signs of how a pregnancy is progressing. Before you ever took a breath of air, you were breathing this fluid in and out. From the acid bath dissolving your lunch to the shock-absorbing cushion your brain still floats in, every one of these fluids does a specialized job that keeps the others from being overwhelmed. A coordinated plumbing system disguised as a body. If this kind of deep biological breakdown is your thing, subscribe for more.